This is a summary of the 2017-2018 financial year for East Lancashire Hospitals NHS Trust. East Lancashire Hospitals NHS Trust covers Blackburn with Darwen, Burnley and Pendle, the Ribble Valley. In 2017-18, the turnover was £495 million, of which 90% of that money was spent on patient care. The Trust, whilst delivering high-quality patient care, generated a surplus of almost £3 million.
During the financial year, April 2017 to March 2018, the whole Trust cared for 762,000 patients. 160,000 of those patients accessed emergency care at Blackburn, Burnley and Accrington. The Trust invested over £17 million on specialist A&E nursing and medical staff. The total cost of providing A&E services was £28 million.
The Trust has 1,022 beds, and over the 12-month period, more than 72,000 patients stayed as an inpatient. 121,000 new patients visited our outpatient clinics, with 102,000 needing a procedure.
Our staff are the most important asset to us at the Trust, keeping the daily routine of the hospital flowing. It is not a surprise that we invested 65% of the Trust's overall costs into our people, employing over 8,000 staff. In total, we spent £103 million on our nurses and midwives, and £83 million on our doctors. Other clinical staff cost £36 million, while our non-clinical support staff cost £101 million.
To ensure our teams had the best equipment to provide safe, personal and effective care to the patients of East Lancashire, we supplied them with £40 million worth of the latest medicines and drugs and £34 million of clinical supplies. We spent £7 million on general supplies like fresh bedding and quality uniforms to keep our patients comfortable during their stay and our staff well dressed.
Running 5 hospitals and numerous health centres across Pennine, Lancashire is no easy feat. We are working closely with our partner organisations to remodel the future provision of the neighbourhood services, finding new ways to work differently both within and outside our hospital environments.
Our overall site costs, including business rates, gas, electric and maintenance, came to £19 million. We provided 1.3 million meals to patient, staff and visitors. £13 million was spent on education and research.
In response to the cyber attack of summer 2017, we spent an additional £2.6 million on preventing such an attack from happening again.
We are investing heavily in emerging technologies and creating new environments. This year has seen the start of the Phase 8 building work on our Burnley site. The £17.6 million development will provide modern, high-quality facilities for a new outpatients department, maxillofacial unit and ophthalmology centre.
This has been an important year for our charity, ELHT and me. Through the kindness and generosity of our fabulous supporters, we have provided medical equipment worth £98,000, which is outside the remit of NHS funding. These added extras support the safe, personal and effective care delivered each day on the wards and in the community.
In summary, we believe the 2017-18 financial year to have been a huge success for East Lancashire Hospitals NHS Trust. We paid 95% of our suppliers within 30 days, and we are currently classed as good by the Care Quality Commission. More importantly, we believe we have spent the money wisely for the patients of East Lancashire. Going forward, we aim to continue to deliver top quality care to the patients of East Lancashire and to look after and nurture our staff.